MSU's Office of K-12 Outreach, bringing innovation and best practices to educators across Michigan, the U.S., and the world.
My name's Amy Henry. I work with the Michigan Department of Education as an education consultant. I'm in the Office of Improvement and Innovation, and I'm in the School Improvement Unit specifically working with the statewide systems of support. So we work to support the priority and focus schools around the state. So within MTSS, there is that standard triangle that everyone's used to seeing. It's got the green, the yellow, and the red. The green is that benchmark stage. This is our core instruction. It's universal. It's what every student gets. So when we talk about Tier 1, we're talking about universal instruction for all students. There are a couple ways to know that your universal instruction is actually effective in doing what you're hoping it's doing. The first way to know that is that you've got 80% of your kids that are at benchmark. That's the number one way to know we've got it going on. Then to do checks on that to see that you're maintaining that is the key piece. So when you've got 80% of your students at benchmark, you want to then say, how many of those students am I maintaining at benchmark? Because that shows you how effective your core instruction is. If your 80% of your students are at benchmark, but you're losing 20% to interventions, then that's a problem, because that shows that maybe your own interventions are working overtime to try and make up for the fact that your core isn't strong enough to maintain. So if your core instruction's at 80%, the other factor you have to look at is that you want to be maintaining 95% of your students at core. So 80% are there just from getting core instruction, they're getting no extra intervention, and you're maintaining 95% of those students at that level. That shows you that what's going on at your core level is good. It's a good practice. Tier 2 is very similar. Once you have that 80%, then you generally want to see no more than 15% at that Tier 2 level, hopefully less. But if you've got 15%, you're within what we would say is an effective system. So 15% at Tier 2 is considered effective, but there's also that same measurement of how many kids are we pushing out? How many kids are we moving up to Tier 1? How many kids are we seeing that bump? And so you want to have 15% there, and you want to see 80% of your students moving out into Tier 1 supports. So that's kind of the way to measure, are my Tier 2 interventions actually working? Are they doing what we're hoping that they're doing? Same thing with your Tier 3. Your Tier 3 should have 5% max. So you want to see no more than 5% of your students at that level, needing that level of support. And then you also want to see 80% moving out and either into Tier 2 or to Tier 1 instruction, because when that's happening, you know that you're doing the right thing within that tier. You're meeting the needs of your students. So most people ask, how do I assess this? How do I measure where my students are at and where they're moving to? And the most common assessments we see, and some of those the most reliable around literacy specifically, because that's what I've always worked with, so it's the most familiar example I have. We see a lot of DIBELS and we see a lot of AIMS-Web. And those are two really great assessments for universal screening and for progress monitoring. They have really nice tools available for people. When you use those tools, you can use them for that universal screener piece, and you generally are going to have a 3-time-a-year dipstick. So you're going to, at the beginning of the year, you're going to check them, middle of the year, you're going to check them, end of the year, you're going to check them. And from there, you kind of watch what that data shows you. How many students are at benchmark, track individual students, you're going to track cohorts of students and see how many are maintaining, how many are pulling out and going into the higher, they're getting into the Tier 1 or the Tier 2. You follow those students through those mechanisms to decide what supports your system needs. You can drill deeper and find out skill levels that are missing. Maybe you're struggling with comprehension and you want to, stick some of those strategies, some comprehension strategies right into your Tier 1 because a multitude of your students need it. That might be one way that you address it. But we use that data to kind of help drive our instructional practices. So when we talk about universal screening, we're looking at using that dipstick 3 times a year. Most universal screeners are set up to be to watch the student and to actually measure for where that student should be at that point in the year. There are other assessments that are considered more summative in nature. Generally, this is going to be something like your NWEA assessment. You could look at your state level assessments. That way, there are many of them out there. And when you look at those in that summative nature, they're some of them do kind of a pre and post almost from the beginning to the end of the year. And those assessments are really, and we kind of joke about it in some of our presentations, that assessment really is more of an autopsy when you talk about what a summative assessment is, if you're looking at it in medical terms, because it's done and over with. There's nothing you can do about it. But then when we talk about formative assessments or progress monitoring, anything diagnostic that you would do in between, something as simple as a quiz that a teacher would give in a class or an oral exercise they would do as a way to measure what student has grasped the content. Those types of assessments are the ones that get at the actual learning in the moment. And those are the types of assessments that help drive our instruction on a day-to-day basis. So within this MTSS framework, you're using those assessments to guide where those students are at maybe within your tiers. Progress monitoring definitely helps with seeing if the intervention or the extra instruction that you're giving a student is meeting their need, and if it's not, it helps you to tweak that. So you can change your instruction, and then you can hopefully watch them bump up into that next level tier so they're getting where they need to be, closer to their grade level. So we get questions sometimes about how to beef up Tier 1 and how to make that Tier 1 more effective. And it really depends on the school, it depends on the classroom, it depends on the situation. Obviously there are some systems level supports that you need to have in place. There are these really nice drivers, if you get into some research, that are around the implementation of different practices or programs or initiatives. And you really have a few things that you have to have in place. You have to have leadership there to support you. You have to have the organizational structures. So if you've got data, do you have a data warehouse? Do you have a way to fix the systems issue if it comes up? Do you have systems intervention issues? And then you also have the competency driver, which is all around coaching, professional development, the right selection of practices, and maybe the right selection of staff to implement certain practices. Those things all need to be in place. So when we talk about beefing up our Tier 1 instruction, we're really getting at, number one, do we have those things in place to support it for our teachers? But we also need to get it down to the data. It's not a one-size-fits-all. You're not going to find that each school is going to have the same exact thing. You know, this school might be purchasing this reading program, this one's purchasing this math program. Is that going to work for the next school? It just depends. You know, it depends on whether or not their data shows that there's a need for that. Some schools have found that purchasing like a set box program has been the solution for them in some areas, while others have found that, hey, we just were lacking in this area and needed to beef it up, or maybe our curriculum wasn't completely aligned to standards. It's different things that pop up. One specific school that we worked with right in the beginning of this initiative, they kept looking at their reading data and they kept looking at their math data and they kept going, well, why is this happening? Why aren't our kids improving? And we started drilling into their behavior data, which was outrageous. There were thousands of referrals, and they had a K-1 building. So they had all of these, it was a very small building, all of these referrals coming in. And we realized that they had a huge behavior and classroom management issue. And we started to tackle that. And just that year with tackling the behavioral issues, and we implemented a positive behavior supports initiative within that building. And just with the 1 year of that, they cut their referrals in half, and they started to see their data around student achievement increase. So it's just really about diagnosing the building, diagnosing the system, and seeing where they're at. And that's how you start to know what to do with your Tier 1. Sometimes instructional strategies, sometimes not. Really depends on where you're at.